Okay, good day, everyone. This is Public Pulse, navigating policy in the Garden State. I'm David G. Brown II. Today I'll be hosting solo as my co-host Jackie P. Taylor could not join us, but she'll be with us in future episodes. And yes, this is not our first conversation. We're already building a platform to explore New Jersey's most urgent policy questions. To help us get real, I'm joined today by Dr. Barbara George Johnson, Vice President for External Affairs of Urban Policy and the Executive Director of the John S. Watson Institute for Urban Policy and Research at Kean University. From climate resiliency dollars flowing to our coastlines to neighborhood revitalization in Trenton, her team is turning research into results. Dr. Johnson, or my friend Barbara, welcome to Public Pulse.
Thank you, David. Well, it's really a pleasure to be joining you this afternoon. I look forward to our conversation.
Yes. So before we dig into today's policy fights, let's anchor in legacy. Assemblyman John S. Watson broke barriers, first Black freeholder in Mercer County, 6 terms in the Assembly and chairing appropriations. What part of his ethos shows up in your decisions today?
David, everything, every part of his existence, his dedication to public policy, to changing the lives for the better in the communities that he served, really the Mercer County, Trenton community, is how we live and breathe public policy and policy research at the John S. Watson Institute. The John S. Watson was the first chair of an appropriations committee, first African-American chair of an appropriations committee in the country. And that's critical because, appropriations is where the money is, right? How we determine the value that we have in anything that we are giving our dollars to in this, in the country, and particularly when we're talking about the legislative process. So we try to embody that through our mission, which is applied research. We do not research for research's sake, but we look at how research can be conducted in ways that center our communities. We look at those who are the most impacted by particular issues, and we center our research around those individuals. We engage community on a daily basis through all of the centers and the work that we do at those centers, and are really excited to ensure that we're moving the needle in a positive direction for healthy living, well-being, strong economies in our urban centers and rural urban centers in the state of New Jersey.
So, Barbara, what would you think if Assemblyman Watson was here today? What would he think about what's going on in the state of New Jersey and in our nation right now?
Well, I think the more things change, the more they stay the same. And so I think that he may be scratching his head a little bit about the fact that we are still fighting for affordable housing in the state of New Jersey. We are still looking at how we better provide resources to and access to healthcare, how we are addressing the needs of women in maternal child health, with all states across this country, and New Jersey, unfortunately, leading that with disparities in maternal child health among Black women and white women, disparities in infant mortality among Black infants and white infants. So, I think he would be hoping to see the work that we're doing really transform communities, and wishing that there had been some sustainability in what he supported when he was here.
Right. So we're going to get back to some of that infant mortality and maternity statistics, but let's talk a little bit about the Watson Institute. Give us a quick map of the Watson Institute, the policy centers, who you serve, and what do you use to measure success?
So the Institute is very large and very broad in terms of the issues that we work on and try to impact. We have several policy centers at the John S. Watson Institute. We have the Center for the Economic and Workforce Development, Social Entrepreneurship, and Innovation. That is our university center. It's a designation by the Economic Development Authority, the U.S. Economic Development Authority. So we are the University Center for the state of New Jersey. and we do work in helping small businesses to become more resilient and think about recovery, particularly after the exogenous shocks that they have seen recently, whether it was Ida or the COVID or even Sandy. How do businesses that are small recover from those types of shocks? And particularly, how do women and minority-owned businesses recover from that? Because we know that when we had the pandemic, for instance, many small businesses were closed, and we will never see those businesses come back online. So we are working very closely with those businesses, small businesses in the state of New Jersey, in trying to ensure their resiliency. The other centers that we have are the Center for the Urban Environment, which has worked historically on environmental justice. We have the Environmental Justice Alliance of New Jersey. That was an organization that was incubated at the Watson Institute and then rolled out into its own 501c3. They are leading in the voice of environmental justice and how environmental concerns impact communities of color. And so we have been very much at the forefront of leading that work. The cumulative impact legislation that came out of that center is leading the nation in understanding how we decrease particulate matter pollution that really impacts the lives of those who live in densely populated urban centers. So that impacts things like, or has an impact on medical concerns like asthma. The amount of asthma that is predominantly more in urban centers because of the pollution, which is impacted by entities coming in and adding pollution to what is already there, right, is a problem. So cumulative impact legislation helps to decrease the amount of impact that industries have, particularly new industries coming in. What sort of regulations, what mandates do they have to follow as they're building new plants, et cetera, in those areas. So that is another center we have. We have the Center for Health Development and Health Policy Development. And under that center, we've done some work with childhood obesity. We've done work looking at maternal child health. We look at the social determinants of health and work with our community partners and how we create policy that address those issues of health access. And so that is a center that we continue to engage and do work in across the state. We have the New Jersey Urban Mirrors Policy Center. And so I will share that the Institute really started with an opportunity to work with the city of Trenton many years ago and provide policy analysis and policy assessment for that city, which is the capital city. But we know that typically cities' budgets are stretched. And so they never really have the opportunity to have a policy anchor to really support them in helping them to understand how the policies that are passed in the capital really impact their ability to govern. And so out of that relationship with the city of Trenton, we now have 32 plus municipalities that are under the umbrella of the New Jersey Urban Mayors Association. The Policy Center supports the association. It is, if not the only, very few in the country that will provide this kind of support for urban communities in particular. So these are urban mayors and what we call urban rural mayors, because New Jersey is very much a very diverse topography in terms of the geography of the state. And we have municipalities that are in areas where it's highly agricultural. And so you're looking at a Bridgeton in comparison to a Newark. And for those who don't know, Bridgeton is one of our southernmost municipalities, very much an agrarian type of community. And yet, you know, they have the issues of affordable housing, of environmental concerns, health access, and all infrastructure needs, and all the things that you might consider that are necessary when you're thinking about policies for a larger urban city. So that is the Urban Mayors Policy Center. It anchors our work because any policy research that you can think about and issues that you might want to research and address and develop some sort of solution-oriented conversations around will be centered in urban areas. And urban areas are the backbone, right? The centers are the backbone of the economic engine of New Jersey and any state in particular. So that is a center that we really engage our mayors and so forth on issues that are important and necessary for their governance. I think I addressed all of these centers. I'm trying to think of if there's another one that I missed.
I have a follow-up question for you.
One other. Let me not forget the Center for the Positive Development of Urban Children.
Oh, yes.
That's a center that has been around for over 25 years. engaging initially in early childhood education. In New Jersey, we had the Abbott decisions, which said that, there was disparity in a number of school districts in the state of New Jersey. And the Supreme Court's decision in Abbott was that every child in New Jersey deserved a thorough and efficient education. From that came resources and supplemental funding for particular school districts in the state. So we were very involved in ensuring that even on the daycare end of the spectrum of education, that daycare providers in those Abbott districts had the opportunity to be licensed and registered and be able to provide a solid pre-K education and pre-K environment for our kids in urban areas. So we started with early childhood policies. We now have a program that we have rolled out and have been involved in evidence-based and multicultural English language learners and culture as a necessity for engaging with cognitive development, pre-K all the way through 12th grade.
Right. So circling back to the urban mayors, they got a lot of challenges going on today. What is one or two of those challenges that you're hearing collectively from the urban mayors right now?
Affordable housing and housing challenges are really critical to mayors. As you know, David, that when the weather changes, we have to consider those who are unhoused, living on the streets of cities. Mayors are responsible for ensuring that those individuals have options for housing, temporary housing, shelters. When it's really cold outside, how do we ensure we get people into safe spaces? And so that is an ongoing concern for us urban centers. We also know that we have a limited number of affordable housing in the state. And so we are working diligently with organizations like the Housing Community Development Network of New Jersey. We are looking to ensure that the Affordable Housing Trust Fund that set aside monies that is set aside by the state to ensure that developers, municipalities, nonprofits, for-profit institutes can afford to develop affordable housing. And affordable housing varies. We're not talking about low income, right? There are standards and expectations to provide low income housing for all of our cities across the state. But how do we provide affordable? And how are we defining affordable housing? Because we now know that even someone coming out of college in many of our states can't afford to stay at home, to live and have their own apartment. So they're literally going back at home, right? So empty nesting has become re-nesting.
Right.
Because a lot of young people can't afford apartments. They can't afford to come out and say, I'm going to have my own place, much less, purchase a house. So we are looking at many different ways to engage developers, to look at the laws that are around things like land banking. How do municipalities work to identify communities that where they can tap properties, right? That they may want to intentionally work with the community and developers to develop, so that we're thinking about housing in those spaces ahead of time. So we are looking at those kinds of laws and policies to support affordable housing. So that's a critical issue for mayors in our state. Another issue is public safety. We've done a number of hearings, about 2 years ago, we did hearings across the state, asking communities across the state to have conversations with us about decreasing community violence. We are working with our law enforcement executives and others on how we look at policing and public safety in our communities. We do hold symposia, we hold working sessions. We had a symposium in March of this year with National Organization for Black Law Enforcement Administrators and public, what's the organization? Positive Community, which is a magazine that's here in New Jersey and actually New York. It's sort of a regional publication, and brought people together, including young people, to talk about how we make communities safer and how we engage in community conversations that support safety and better communications with police officers.
Yeah, affordable housing and safety is key, definitely. Let's talk a little bit about climate and infrastructure. New Jersey partners, including the Watson Institute, were awarded some federal climate resiliency dollars, part of like a $72 million national pool. How will that money show up in our neighborhoods in the next 24 months or so?
So yeah, the state of New Jersey received 72 million. This Climate Ready New Jersey is the name of the program. However, this is a national effort supported by the Environmental Protection Agency, looking at the impact of climate on our communities and our state. So typically, when we talk about climate in New Jersey, we are focused on our shore communities. However, we are clear after Ida, if not after Sandy, that we have to think about the entire state and how we prepare for emergency responses. But more importantly, how do we think about preemption, right? So that we can build infrastructure that protects our cities and protects our communities from concern when we have extreme climate experiences. So with Climate Ready New Jersey, there are many partners. Kean University and the Watson Institute is one partner, but there are many other universities that are involved, as well as nonprofit and other organizations. We are connected to the Environmental Justice Alliance. So one of the areas that we will be focused on is how we are incorporating those communities that have environmental justice issues. How do we ensure that when we are planning for climate emergencies, that those cities are considered? You know, is the infrastructure strong? Right? Are we looking at infrastructure that can withstand a storm? When our storm drains back up, that leads to flooding. You know, if we have creeks and so forth, or streams in communities that may not have risen in past storms, they might in future storms. So how do we look at protecting water walls and so forth that protect the communities that exist in those spaces? A perfect example was when Ida came through, and there is a housing complex in Elizabeth, New Jersey. I don't know if you're familiar with Elizabeth.
Yes.
But there's a creek that runs behind that complex. And that complex was built probably maybe 4 or 5 years or so before Ida. So relatively new, senior housing, affordable housing for the community. When Ida hit, for the first time in over 100 years, that creek overflowed. The water levels rose. And those individuals, over 700 units of housing, individuals had to be removed from their housing complex, from their housing unit. And it took years, and only recently has that complex been remediated, some portions of it, to allow people to come back. So we want to prevent those kinds of that kind of impact on community. When that happens, you're displacing folks, you're displacing young people from their schools and classrooms, people from jobs who now have to figure out where they're going to move to. And it becomes a real difficult situation for the community. You have a blighted space now sitting, collecting mold and other things that's really environmentally bad for a community. So we want to use Climate Ready New Jersey and the funding and resources to think through how we prepare by building now, by building today, building more green spaces, ensuring that neighborhoods understand what the impact of climate and climate issues means to them and how they can become more prepared.
Right. And one of my things as a city manager, flooding is a major problem across not only New Jersey, but across all the states. And one of the things that I'll be focusing on is writing a policy brief or a paper just on some of the challenges and some of the strategies that we've used in my township, in the township of Ocean. But let's get to health and equity. One of your staples, your background. Your career has a thorough line in public health and maternity infant outcomes. If you had the magic wand and the power to do anything you wanted to do here in the state of New Jersey, what would you do to change in that area?
There are so many things that have to happen for things to change in that area. I mean, first and foremost, obviously, you want to make sure that women have access to really high quality maternal and child health care, right? Whether that is in the early stages of pregnancy, preconception, all the way through to delivery of a baby and then postpartum. And that care requires a number of things. It requires, women to have social service support, to have mental health support, to have support for their children that might already be in the house. What I'm excited about is that in New Jersey, we really have started to focus on this issue of disparities in maternal child health outcomes. When this administration with First Lady Tammy Murphy came in, we started the conversations on what was necessary to really change the trajectory to a more positive outcome, particularly for Black women, because in New Jersey, Black women were 7 times more likely to die in childbirth than white women. Black babies were 3 times more likely to die in the first year of life, known as infant mortality, than white women. And in one of the most advanced nations, in one of the most economically sound states, whether we believe that or not, it is, right? How can we allow that to happen?
Right.
So over the last several years, there have been a number of summits and meetings and conversations, and I'm excited about the new New Jersey Maternal and Infant Health Innovation Center that's being built in Trenton. We have the New Jersey Maternal and Innovation Authority that is the only authority of its kind in the country, simply focused on maternal child health. And I'm happy to say that I'm board chair of that entity, working very closely with Lisa Asaris, who's the president of that of our news authority, and excited about how we change the trajectory of maternal health for Black women and all women in the state of New Jersey. We had the opportunity. You asked me what would I do. I got a chance to do some of the things I want to do in that space. Good. Because we had the opportunity to center this work with women who are most impacted. So a lot of times we're here creating policies and thinking that we have all the answers, but regardless of your ethnicity as an executive, right, or your power, your access to opportunities to change things, you can't change anything if you don't speak to the people that are most impacted.
Yes.
So we had an opportunity to be on the ground in the city of Trenton, engaging with women for 3 years and understanding where they are in terms of their need for proper care, for their families, for their mental health, for their maternal outcomes, their access to care. So we had the opportunity to really hear from them as we go into designing the center. A lot of what we heard, a lot of the engagement with women on the ground went into the design of the center. So I am really looking forward to a time in the state where this center will be the pinnacle of innovation for women who are pregnant or seeking to become pregnant, and for babies that are born in the state of New Jersey. Really excited to see what the outcomes will be there. We will be tracking the engagement with our community, with women who need services, and looking to make sure that we are shifting the trajectory in a more positive direction for that outcome.
Wow, awesome work. So let's talk Trenton. Trenton's Coalport Neighborhood Plan, $750,000 to design housing, economic mobility, and jobs. What's the playbook here? What are you doing in Trenton right now with the Coalport Neighborhood Plan?
Coalport is really interesting and dear to my heart. So I will share with you that, oh goodness gracious, almost 10 years ago.
Okay.
Jay Watson, who is the son of John S. Watson and an environmentalist, came to the Watson Institute and asked us to participate in a community project looking at developing an urban farm in the center of the city.
Oh, wow.
And that was an interesting concept because at the time we were looking at farms, in general, more healthier produce and fresh fruits and vegetables to areas that folks were calling food deserts.
Yes.
Right. So I don't like the term food desert. So I say it's a food swamp, right? Or it's a food dump, because at the end of the day, in areas where we call food deserts, they're not really deserts. There's food. There's just poorly nutritioned food, right? So we want to make sure that we are providing in those spaces opportunities for people to have fresh produce, fresh vegetables, etc. And so we had the opportunity to create this farm. The farm has now been there for about 8 or so years. It is right smack in the middle of Trenton, over on the east, northeast side. And community gets to be there. They get to engage on the farm, access produce. There are local businesses that some of the produce is exchanged with. And then there's the Trenton Area Soup Kitchen right next door to the farm. And so they use the produce that comes off of that farm to support the nutritional needs of their service, their residents and so forth that they service every day at the soup kitchen. So out of that work came the understanding that there should be more. We should use the farm as an anchor asset because it's now developed. People are excited about being there. How do we use it as an asset to grow and develop this area that was known as Coalport? Area of Coalport, traditionally, historically, it was part of that space in Trenton where Trenton Makes and the World Takes kind of came out of. So
Yeah.
a lot of industry, a lot of opportunities for growing and developing things. A community was formed around that area with our urban renewal, that wonderful federal policy of urban renewal where they built highways in the middle of communities and neighborhoods. They were mostly Black and brown
Yes.
for other folks to get around while destroying community. And so we know that Coalport historically was a part of that process as well. So here we are now in 2025, having been in this community, developed the farm, engaging with community members and nonprofits. There was an ideal by our partners to consider creating a plan for this section that extends beyond the farm several blocks, that has a number of social services, but also really blighted. And how do we then turn that into a vibrant area with housing, with other social services, with an area that the community can come into and maybe a community lab space where they can learn about how they sustain themselves through all different kinds of needs and issues, and then continue to use a farm as a place to gather and think about, problem solving and arts and music and all of the things that community really would want to engage with for well-being. So that is really what the Coalport Project is about. We are working with partners in Trenton. We are using and engaging with our School for Public Architecture here at Kean. So we are approaching architecture in a way that allows our students to see the importance of understanding community and thinking about a community, the culture of the community needs when they're designing, when they're rendering architectural designs. So our students are involved in the Coalport Project. We are also looking at figuring out how we think about health and healthcare access and what that means for the community in that space as well. So we are doing a lot of focus groups and thinking about a comprehensive and holistic approach to community development and developing all kinds of businesses and housing and other green spaces in that Coalport area.
Okay. So I got one last question for you, and then we'll close this out. So, the one relationship that excites me the most is our collaboration between the Watson Institute and the New Jersey Chapter NFBPA. Talk about how that partnership is going, where we're headed, and what you foresee in the future.
So I'm excited that we've talked about it for a while, and I'm excited that we are now in partners with the National Forum for Black Public Administrators. Our interest, David, is ensuring that we have a strong and robust chapter in New Jersey, as you know, because we have the relationship and the management of the New Jersey Urban Mayors Association. I would really love to see more partnering with the association members. Again, as you know, what I love about the NFBPA is its focus on municipal governance and those who are professionals in that space. So how do we work with you all to ensure that we're providing opportunities for collective thinking as municipal and public administrators, right? Training needs that they may have in skill building and skill preparation under the Kean Transformational Learning Division. So you know that the division of the Watson Institute is under Kean is the Transformational Learning External Affairs. And under Transformational Learning, we provide a degree completion for adults. We do micro-credentialing and all kinds of training programs. So for me, it's ensuring that we are bringing value to what NFBPA already does as a university in engaging and strengthening the skills of our public administrators, giving them a space to come together and to brainstorm and think about how they build relationships that build better governance in their areas, and ensuring that as a whole we can really expand the impact of the organization. We also, at some point, want to build our policy platform with NFBPA, because I think there are opportunities to really, and synergies around, obviously, the work that we are already doing in urban communities with those members at NFBPA and the organization itself on public policy issues that impact the association.
Yes, and that would be perfect since they just made me the national chair of public policy, so we can intertwine and collaborate on that. But Barbara, this has been great. It's been a great conversation. You and I have known each other for over a decade when we worked on the SEDS project, so it's just a pleasure for you to be here. I look forward to our collaboration and partnership going forward with NFBPA, the Urban Mayors, Watson Institute. Always a pleasure as a Kean University alumni. Look forward to possibly even getting Dr. Repillette on here at some point too. But today we heard how legacy drives action, how climate and health investments land locally, and what cities can copy from Trenton, from the Watson Institute. So let's follow the John S. Watson Institute for Urban Policy and Research at Kean University to track their work. There's amazing work that you've heard here today that Barbara and her team are doing. And again, we thank you and your team because we're all working on this together. And I'm just going to ask all our viewers right now if you could just subscribe, share, and send us any of the hardest questions that you want answered on Public Pulse. I'm David G. Brown II. We'll see you next time on Public Pulse. Have a great day.
Thank you, David.
Thank you.